Excuse me, this is the wrong method of hand washing.
Sorry madam, what is the right method?
Welcome to all of you. We, the students of Gitanjali College of Nursing Udaipur, are presenting video demonstration on hand washing with the purpose of enhancing knowledge regarding hand washing. Firstly, we will talk about introduction. Hand washing was invented by Joseph Lister and hand washing day is celebrated on 5th of May. There are two types of hand washing. Number 1, medical hand washing. Medical hand washing is also known as clean technique. Number 2 is surgical hand washing. Surgical hand washing should be performed in OT areas. In surgical hand washing, there are two types of scrub. Number 1, numbered stroke method. Number 2, time scrubbed method. The World Health Organization has described 5 key moments of hand washing. Number 1, before touching a patient. Number 2, before clean or aseptic procedure. Number 3, after body fluid exposure risk. Number 4, after touching a patient. Number 5, after touching the patient's surrounding. The articles required for hand washing are: for medical hand washing, number 1, a source of running water to wash hands thoroughly. Number 2, antimicrobial soap to remove the dirt and microbes from hands. Number 3, towel to dry hands. In surgical hand washing, number 1, a source of running water to wash hands thoroughly. Number 2, antimicrobial soap to remove the dirt and microbes from hands. Number 3, towel to dry hands. Number 4, a cap, a mask and a shoe cover. Firstly, let's learn about medical hand washing. Medical hand washing should be performed before and after all non-invasive procedures. Medium flow and warm water is appropriate when you wash your hands. The entire procedure for medical hand washing should take 1 to 2 minutes and 8 to 10 seconds for each step. Now, we will look into the steps of procedure for medical hand washing. Priorly, the nurse should inspect surface of hands for breaks or any cuts because it is the mode of entry for microorganisms. Then, inspect the condition of nails, which should not be long and should not wear artificial nails or extensions or nail paint. Remove wristwatch and push long uniform sleeves above the elbow joint. Remove all jewelry from hands such as ring, bracelet, etc. Stand in front of the sink, keeping hands and uniform away from sink surfaces. Turn on water, avoid splashing water against uniform. Wet hands and wrist thoroughly under running water. Apply a small amount of soap or antiseptic and lather thoroughly. Now wash your hands using plenty of lather and friction using World Health Organization 6 steps of hand washing. Number 1, rub hands palm to palm together. Number 2, rub left palm over the right dorsum and right palm over the left dorsum. Number 3, rub palm to palm interlaced. Number 4, interlock finger and rub the back of finger of both hands. Number 5, rub thumb in a rotating manner. Number 6, rub left hand fingertip over the right palm and repeat vice versa. Then rinse hands and wrists thoroughly, keeping hands and forearms below the level of your elbow. Turn off the water using a towel. Dry hands thoroughly from fingers to wrist and forearms by tapping with the towel. Now, next let's learn about surgical hand washing. Surgical hand washing should be performed before and after all invasive procedure, and the entire procedure takes 5 to 7 minutes and single step should take 10 to 15 seconds each. Now let's look into the steps of procedure for surgical hand washing. Firstly, remove bracelets, rings and watches. Ensure that the nails are trim and no nail paint and no artificial nails are allowed. Inspect hands for cuts and open lesions. Apply surgical cap, face mask, shoe cover, and any neck jewelry is contained inside surgical attire scrubs. Pre-wash your hands with antiseptic soap only if it is visibly soiled. Use disposable nail pick to remove the dirt under your nails and dispose it in the trash bin. Rinse hands and forearms. Remove sterile or surgical sponge and apply antimicrobial agent on it. Visualize each finger, hands and arms as having 4 sides. Scrub the nails of one hand with 15 strokes and then other with 15 strokes. Turn the side of scrub to non-abrasive side. Then scrub palm of one hand with 10 strokes. Turn the hand over and scrub the dorsal surface 10 strokes. Then scrub outside surface of thumb from wrist to tip of thumb 10 strokes. Continue to apply other side of thumb 10 strokes. Now scrub each side of fingers 10 strokes. Once you scrub an area, do not go back. Divide the forearm into thirds from wrist up to 2 inches above the elbow and scrub each third 10 times. Repeat the scrub on the other hand and arm. When both hands and arms are complete, discard the sponge. Keeping your hands above the elbow level at 90-degree angle, rinse your hand from fingertips to elbow in one continuous motion. Remember, do not move arms back and forth in the water. If you touch a non-sterile surface during rinsing, redo the entire scrub procedure with a new sponge. Now, turn off water with foot or knee control but do not with hands. Keep hands elevated and away from the basin, scrub attire and non-sterile surfaces. Allow residual water to drip off the hands into the sink. Do not shake or wave hands and arms to remove the excess. Dry hands and forearm with a sterile towel by tapping, moving from fingers to elbows in a rotating motion for both the hands. Now, drop the towel into linen